Good day. This is Jerian, your therapist, sharing with you the interventions of dysfunctional movements that develop for patients with CNS or central nervous system problems. Let us understand first the Rood approach. Cultivated by Margaret Rood, Rood's approach deals with motor patterns that are developed from primitive reflexes through proper sensory stimuli to the appropriate sensory receptor in normal sequential development pattern to improve motor performance. Apparently, it is based on the hierarchical model, with its four principles namely normalization of tone, purposeful movement, ontogenetic developmental sequence, and repetition of movement. Facilitatory and inhibitory techniques possess the goal of patients mostly dealing with spasticity or muscle weakness. Let me present to you some of the techniques by Rood approach.
Facilitatory techniques. Light moving touch. With the use of your fingertips or a brush, if you have any, smoothly brush it for 3 to 5 repeats. Fast brushing. With your thick brush, or my hands as what you can see in the screen right now, run them through the patient's arm. This technique facilitates and enhances static holding postural extensors and will have immediate and long latency responses. Icing. This technique requires ice apparently and a towel. You must apply it on a muscle which aims for the intervention. With 3 quick swipes, immediately wipe up and drench the muscle. Resistance. This technique can be applied manually, mechanically, or by using gravity and body weight. Resistance facilitates muscle contraction, which is proportional to the amount of resistance applied. 2 benefits cultivated are improving kinesthetic awareness and increasing strength. Approximation. The patients must be in crawl-like position and right after, perform the approximation by using weight-bearing postures. The benefit gained from this technique is joint awareness from the facilitation of postural extensor. Stretch. In this technique, the patient must be lying from his or her side on the ground. Ask them to move sideways along with your actual intention, which is to contract for an improvement. Tapping. Commonly tapped muscle is the arm, and by that, with 3 to 5 repeated taps, your intention is the activation of the latter. Vestibular stimulation. As the patient lies back on the ground, slowly move its head up and down, or side by side. Its intention is to activate flexibility on the spastic muscle of the patient. Inhibitory techniques. Slow stroking. Slow rolling. The same position as executed in stretch. Move the patient in and out to relax and reduce the abnormal tone of its muscles. Maintain stretch. The patient must lie on his back as his legs will be stretched up to reduce the sensitivity of his muscle when stretched.
These techniques are prominently practiced on clinics by therapists that aims for an effective result with physiological basis of treatment. Though it may not widely present, but the therapy of waking up the motor responses are a part of detrimental changes from the abnormality of muscles. This is Jerry and your therapist. Have a nice day ahead.